This is a Defocus Media production. What's up, everyone? It's your favorite optometrist, Dr. Daryl Glover.
And I'm Dr. Jennifer Lyerly, resident optometry nerd.
And welcome to Defocus Media, optometry's #1 podcast, where we discuss the hottest topics, latest technology, eyewear, practice management, and more. So sit back, relax, and defocus.
Hey everybody, welcome to a new episode of the Defocus Media podcast. Have you been feeling a little stressed lately, a little bit overwhelmed by the workplace? Well, this is a good episode for you to join in. We're going to be digging into the statistics around optometry burnout and what we can do to help make our lives more enjoyable, find the love and passion for our career again. As some people have the balance figured out a little bit better, and there's a few numbers that can help guide us on how to find that better work-life balance potentially. I'm joined with an expert guest, Dr. Kaleb Abbott. Welcome to the show.
Thanks for having me. Appreciate it.
I've been so thrilled to see so many publications share your recent study about burnout and optometry. And as soon as I read this document that you had written, I was like, I want to talk about this more deeply on the podcast because it has gotten to be a bit more trendy lately to talk about burnout across all of healthcare. I've seen publications in JAMA talking about physician burnout, but we've never really seen a specific optometry burnout article until you shared your statistics. So thank you so much for your hard work.
Of course. And yeah, I totally agree. Mental health is starting to be something that people are focusing on more and more, especially post-pandemic. I think that's really kind of highlighted practitioner burnout in particular.
Dr. Abbott, would you mind sharing a little bit about yourself and how you got interested in burnout?
Yeah, my name is Kaleb Abbott. I'm an optometrist and assistant professor at the University of Colorado School of Medicine. I'm about 75% clinical and 25% research, and I practice exclusively in our dry eye clinic and our Center for Ocular Inflammation. But in 2024, I found myself feeling extremely burnt out. I was trying to juggle a lot of clinic responsibilities, involvement in clinical trials, ongoing research projects, and I was really struggling to maintain a healthy work-life balance. And I started wondering just how widespread is the issue of burnout in optometry. So this curiosity led to me asking the question, what causes burnout, specifically in optometry, and just how common is it? So naturally, as a researcher, I did what we often do when we're faced with an important question. I decided to launch a large-scale study to try to figure out some answers. And spoiler alert, if you are already feeling burnt out, taking on an additional study investigating burnout will not actually help your situation.
I want to just put this into context for people. Before we started to record, you shared at one point, maybe around the time you were starting to do this research, you were booked out for 6 months. Patients would call to make an appointment at the dry center, and they had a 6-month wait time. So when we're talking about a crowded clinic schedule, I don't know too many people in the United States that are having to deal with a patient backlog of 6 months worth. So truly a burnout stat to share about your clinical life.
Totally.
That has improved, by the way. So
yes, it has.
Things are running a little bit smoother for you now. So you have time to take on more research, probably.
Yeah, which is great. And I'm trying to actually spend a little bit less time in clinic, a little bit more time focusing on research, which according to the data from our study actually shows us, that you can improve your burnout if you're spending less days in clinic. And we'll delve more into that.
Oh, yeah. Well, one of the things that you mentioned when we first started recording was, we talk about burnout, we talk about mental health for physicians, but have we really talked about what it means to patient care and health outcomes? Like, why should we care? I mean, of course we care as a person, like, oh, I'm feeling burnout and stress, but how is it impacting the greater healthcare community, the greater healthcare that we're providing to our patients when physicians are burned out?
Yes, I think that is a super important question. We all hear the term burnout, but what does it actually mean if someone's burnt out? How does it affect providers? And how does it also affect patients that those providers are seeing? And there's a lot of data that's starting to come out on burnout. And we know that we can really think about this in two different ways, providers and patients. When it comes to providers, we see that providers that are burnt out have increased job turnover, they have reduced productivity, higher rates of medical errors, more malpractice lawsuits. It affects their mental health, so it contributes to depression, suicidal ideation, and even things like substance abuse. And then overall just decreases the quality of life for those providers. But then from the patient perspective, when a provider is burnt out and is seeing patients, we know that it directly impacts patient care as well. So providers that are burnt out provide worse quality of care. We know that there's communication breakdowns that happen between the provider and the patients. It impairs the decision-making of that provider. It decreases empathy that the provider is having with the patient. And we know that this kind of directly translates to worse patient satisfaction, a reduced chance that that patient is going to adhere to the medical advice that that provider is giving to the patient, and then overall just worse patient outcomes.
Affecting things at every level. What you're sharing reminds me of a study I recently led. It's published in the JAMA Internal Medicine in May, and they surveyed 970 physicians. About half of them reported burnout, 47.9%, and 26.4% of those physicians indicated their intent to reduce clinical work hours or potentially even find a new job. So it's causing physicians to say, hey, I'm ready to exit this workplace. I want to see less patients. I want to leave my job. That's a major issue when we already have shortages of healthcare providers. So I think that really underlines what you were sharing about how important it is to try to solve this issue so that patients continue to have access to care and good quality care.
Yeah, and I think providers understand what's causing burnout a lot of times, not always, but a lot of times. So the instinct to cut back on number of patients and number of days in clinic, based off our research, shows that could be helpful for practitioners.
So let's talk a little bit about the burnout numbers within optometry and ophthalmology, because I'm sharing some stats from overall physicians. Do we have more data to say ophthalmology, optometry, what are our burnout rates compared to other healthcare professionals?
Yeah, so first off, burnout is certainly a widespread issue in healthcare. So if you look at different specialties, typically the burnout ranges from 35% to 50%, depending on specialty and setting. And in general, we know that physicians report burnout at nearly double the rate of the general workforce. So people that are practicing in healthcare generally have about double the burnout of those that are not in healthcare. So it is certainly a pervasive and systemic issue within healthcare settings. One thing that it's challenging to compare burnout amongst different specialties kind of with the looming pandemic results that we have. So the best data that we have for ophthalmology actually was a survey that was conducted at the University of Colorado, but it was conducted in 2019 and published in 2020. So this is pre-pandemic, and we're comparing this to our study, which is post-pandemic. But in that study, we found that ophthalmologists, about 37.8% of them reported symptoms of burnout. Now, in our study, we found that 53.6% of optometrists report symptoms of burnout. So over half of our colleagues are having symptoms of burnout. And that's substantially higher than our ophthalmology colleagues, but again, a little bit hard to compare pre and post pandemic. I know that our site is actually repeating that study on ophthalmologists right now, and that's hopefully going to be published in a few months. But we do know that the burnout has increased in ophthalmology post-pandemic, but is actually still not as high as optometry. So I think the question is, why are optometrists more burnt out than ophthalmologists? I think optometry, we face some unique stressors. And I think one possible explanation for optometry being more burnt out than ophthalmology is that we have less variety in our work. Ophthalmology oftentimes will have clinic days and then they'll have surgery days. So there's a little bit more variety, whereas optometry, I feel like we are in clinic most of the time and we're focused more on repetitive tasks like refractive care. And I think that lack of variety can contribute to burnout in our field.
I do think one of the things that is a challenge for all healthcare providers is, yes, it's a high intense mental job. It's a high skill job, but it's also at the end of the day, a customer service job. And some of the things that I think cause the most fatigue within our profession is kind of unrealistic expectations and trying to meet that customer service aspect of it, where maybe ophthalmology does get some freedom from some of the mundane arguing about a copay situation, where they can just, do their surgery and focus on their technical skills sometimes and get away from some of the less pleasing customer service monetary aspects.
Yes, that's a great point.
But I don't have the studies to back that up. Might be some of the research that you can delve into when you create your next survey. I want to share a little bit. So the research that we're talking about that you performed, this was published June edition of the Journal of Optometry, and it's called Insights into Burnout Among Optometrists in the United States, Findings from a Nationwide Survey. You surveyed over 1,000 optometrists based on the AAO listservs, and that's where the study data came from. So that's the title of the research if you guys want to go look this up and read it after the show. We're going to dig into the stats from this because you teased out a lot of information about different career paths, different career modalities that have more or less stress or burnout associated. So let's talk about practice setting. What did you find from these surveys to be the more stressful or the higher burnout rate practice settings versus the less likely to have these issues?
Yeah, I guess first I'll say we had 1,436 respondents, which is a lot of respondents. To date, this is the largest burnout study that's ever been conducted in our field and the only nationwide one. So the more respondents you have, the more power you have in the study, so you can get much better data. So we were pretty happy with the number of respondents we got. So when we looked at practice settings specifically, the settings that had the highest amounts of burnout were hospital settings, integrated healthcare systems like a Kaiser, those optometrists practicing in departments of ophthalmology, followed by commercial settings. And then right after commercial settings was ODMD practices. I actually had similar rates of burnout in ODMD practices to commercial settings. We also found really, really high rates of burnout in teleoptometry. However, we only had 3 respondents out of 1,436 that were practicing teleoptometry. So it's not exactly the most robust data, but 100% of those patients, all 3 of them, reported symptoms of burnout.
Wow. Just to kind of explain this a little bit more, what were the symptoms of burnout that you guys were asking about?
In our study, we used the mini-Z survey, which is really looking at all burnout, but then a bunch of different factors associated with burnout. And we left it a little bit open-ended. So we were just asking if these providers are having any symptoms of burnout and almost leaving it a little bit self-described.
Okay, got it. I think the teleoptometry, that is fascinating because in our mind, many of us, I think, well, that would be, you work from home, you don't have to get dressed, but I personally, the thought of teleoptometry is extremely stressful to me because I know how hard it is to see certain conditions in a slit lamp with my own eyes. 3-dimensional. So I would be on pins and needles if I was doing teleoptometry about all the things that I was probably missing. So I can totally, that makes sense to me. That tracks.
Yeah, and they see a lot of patients. I mean, I've talked to people who do this and they'll see 50, 60 patients in a day. And we know from our study, the more patients you see, the more burnt out you are. Now, the settings that had the least amount of burnout were private practices and those optometrists practicing in academia, so schools of optometry. And we actually found that the practice setting with the least amount of burnout overall was large group practices. And then after that was small group and solo group, and then academic optometry.
What I kind of see from hearing these is you've got more people that you can rely upon to share patient care, potentially lower number of patients being seen by each individual doctor. And then when you look at academics, yes, they're seeing less patients, but there's also so much variety. They get to teach, they get to mentor. Their clinical care day has so much variety within it. So if you can diversify how you're seeing patients or share the load better amongst your colleagues, that might help reduce burnout symptoms.
Yes, I totally agree. So the variety, I think, is really important. If you're getting time away to do administrative work that's dedicated time or research time, or if you're able to see a wide variety of patients as opposed to maybe just doing a glass prescription all day, every day, then I think that it ends up reducing your rates of burnout.
Yeah. So one of the other things that you guys looked at, and you looked at a lot of factors here, I want to kind of go through bit by bit to see what practice aspects were more or less likely to lead to burnout, and also what personal life aspects were more or less likely to lead to burnout. One thing that jumped to me right away was EHR use. And you guys found that doctors that were using an EHR were much likely to experience burnout than doctors who were not using EHR, which I'm not positive how many people are not using EHR now, but maybe you have that data from your survey.
Yeah, in our survey, I think it was roughly 9% of our colleagues that are still using paper charts.
Wow, the few, the proud.
Yes.
On paper, this is a number that really spoke to me because I cannot imagine practicing without EHR. We come from this generation of optometry. From the moment we were in optometry school, we were on EHR, right? So we've got this is kind of like those elder millennials were the last of a generation that probably ever was practicing around paper. So in theory, EHR makes everything better, right? We're not having to dig through paper charts. It's so easy to access information, to pull forward past histories. And yet there's something so innately stressful about having constant access to your patients and your patients having constant access to you. And I wonder if maybe that's what's happening in this EHR situation. There was a study that I was super interested in that got published earlier this year that looked at, it was actually out of North Carolina, out of Wake Forest University, and it was for physicians at Wake Forest Baptist Hospital. So it was not optometry specific. But what they found was on their paid vacation days off, over a third of doctors were logging into their EHR.
Yeah.
19% of the time they were spending over 30 minutes on their EHR. So we don't give ourselves the opportunity to truly get away when we have a day off, when we're on vacation, because of EHR, because of email. That electronic access makes people think that they need to be constantly logged in.
I totally understand that. So our EHR, we have an app. It's called Haiku. And I actually have had to set time limits on my app. So I'm not constantly staring at my phone, responding to patient messages, refilling meds, things like that. Because I found that the more time I spend on that app trying to help patients, the more stressed I end up becoming. But I think that I think it's really interesting that, EHR was so associated with burnout. And this was very, very robust data. Even when we corrected for all other variables, so did multivariate analysis, this remains statistically significant. And I think one thing that we found that was strongly associated with higher levels of burnout was if you're using EHR at home. So if you are off the clock, not in your practice, and you're still doing work at home, that was very associated with burnout.
Do you, just in principle, because I know this is a big one that's showing up in multiple studies, any advice on how doctors might be able to set guidelines or barriers? Because we are, overwhelmingly majority of us are going to be using EHR in our practices. That's not something going back in the bottle. So how do we help protect ourselves knowing that this is a problem for burnout?
Man, so our study was mostly trying to figure out what causes burnout, not necessarily how to reduce it. So I don't have all of the answers. But, I have noticed, so the burnout statistics around EHR was also significantly worse in females. And at least with my colleagues, I know that a lot of the females that I work with do a lot more charting. So there's a lot more descriptions in the assessment, in the plan, things like that, a lot more detail. They spend a lot more time on this. We also know that females in general are more likely to be the ones that are charting at home. So, I mean, even though patients want to see a lot of details in the chart notes, I've tried to keep it, brief, to the point, so I'm not sitting there charting all of, to long hours throughout the day and once I'm at home. So I'm trying to keep it more brief. I'm trying to finish my work before I leave work and not take it home with me whenever possible. I think that's the best advice I have. Great
advice, because once you get logged in, then you're going to see all the other messages that you have, and you know what I mean? Like, as soon as you know about them, they're impossible not to respond to you. My other little tip, and this is from a friend recently, Dr. Jackie Garlick, who y'all may be very familiar with from 2020 Glance. She shared to me what a difference maker this has been. It's so obvious, but put a vacation responder on your email. Even when you're going to be gone for a day or two. Do not log into your work email. Have that, and just knowing that if a patient's messaging that they're getting a vacation responder, I don't feel the need. They know I'm not going to be getting back to them until I get back into the office. And I would love to see maybe a future EHR build out where vacation responders were a normal part of Haiku or some of these EHR build outs. So a patient could get an away message from a doctor when a doctor is not going to be there to answer. And that just gives the doctor the peace of mind, like, they don't expect me to answer this in the next 30 minutes.
I'm honestly terrible at this. I'm constantly responding to emails. I do a bad job taking breaks. I actually like going, to places that I can't have my phone with me. So I like going to the mountains where I don't have cell signal and I can't be checking email and things like that. One thing that we looked at in this study, I think you'd find interesting, was using a medical scribe to help you with your EHR associated with less burnout, and it was not. So
Wow.
I thought having a scribe would help with burnout, and it did not in our study.
Well,
So interesting.
that's unfortunate. That's one of the things I was thinking too. And there's all these AI scribes, like virtual scribes that are happening now. So maybe that's not going to be as helpful as we thought for reducing burnout, but who knows?
I don't know. We'll see.
All right, let's talk about some of the other factors. So this was a surprise one for me. I want to see if you felt having children more or less likely to have burnout.
Yes, this was a very controversial finding, but we found that respondents with children were less likely to experience burnout. And the reviewers gave us a very hard time for this. They wanted us to show them lots of other data from other studies. They wanted us to justify this. But honestly, there's not a lot of data out on this. We are one of the only studies that have asked about children and professional burnout. There are some nursing studies that have asked about this. Some of those studies have agreed with our findings that children are protective against burnout. Other studies disagreed with this, but this is something that I think we don't understand too well. But probably the most probable explanation that we have found for why having children protects against burnout is that it helps you disassociate from work. I know I've got twin 8-month-olds and a 4-year-old at home, and when I come home, I can't think about work anymore because my life is so hectic at home. I mean, I have to disengage entirely because I'm chasing kids all over the house and trying to feed kids and change diapers and this and that. And actually, I think it's helpful. It helps me not think about work as much. And when we delved a little bit deeper into the data here, this actually isn't published in the study, but we found that this is more true for women than it is for men. So it actually made a bigger difference for women than men. And so you might say, well, maybe the women are, working less hours, maybe they're part-time if they're moms. But we actually ran multivariate analysis on this. So we factored in everything that could possibly confound it, and it still remained statistically significant.
Wow.
So I thought that was a very interesting finding, but we caught a lot of heat for that finding. But the data is the data, and I don't know what else to say about that. But yeah, children are protective against burnout when it comes to professional burnout for optometrists.
My thought was, maybe because you have children, you're working more part-time. So I love that you guys dug deeper and ruled that out. That wasn't the variable that was making having children less associated with burnout. The other thing that comes to mind, like you said, you're incapable of continuing to focus on work because other people need you.
Yes.
It's made me as a mom, I sometimes can't wait to go back to work. I mean, I love my daughter. I love being a mom, but there's something I could do something different. I could stay at this house, keep cleaning the toilets, keep grocery shopping, or I could go to work and get to think a little bit differently. And that gives me some excitement to be like, I get to see patients today.
Yes, I totally agree. And I guess one thing to also keep in mind, we are asking specifically about professional burnout. There's also such a thing as, home burnout and, all of the pressures surrounding that. So our data was specifically about professional burnout.
So this ties into children a little bit, but having a spouse, more or less burnout.
Yes, this was also a surprising finding, but we didn't catch as much heat for it. But if you have a spouse that's also practicing in healthcare, you are less likely to experience symptoms of burnout.
That's wonderful. And optometrists marry each other all the time, so that's...
Yes, that's true. Yeah.
This is an unrelated additional stat, but I saw this the other day. Apparently, optometry as a profession, one of the lowest divorce rates of all professions.
Really?
It's something like 20.8% of optometrists get divorced compared to, more like 50-50 with national averages.
Wow. I'll have to tell that to my wife. That'll make her happy.
Yes. We're just very marriageable. So that's great for burnout.
Well, I think, so the reviewers were asking us, why do you think that's the case? That, if you have a spouse in healthcare or a partner in healthcare, that you're less likely to be burnt out. And I think it's because your spouse or partner just understands your job pressures. They understand what you're doing a little bit more. You could probably talk to them about it a little bit more. If I was married to a spouse that was doing investment banking, I was trying to share my patient frustrations, I don't think that spouse would understand. So I think that potentially that's why there's less burnout.
Any stat that you feel like from your research that I think it was obvious, like seeing less patients doing less clinical care days. Those things, of course, are going to give you a little bit more diversity of schedule, a little bit more time to recuperate. Any other stat that you found surprising from this research?
Yeah, so I guess when it comes to clinic, so you had mentioned, less patients, you have less burnout, less number of days in clinic, less burnout. I think one interesting thing was we were able to kind of quantify that. So those with no burnout on average were in clinic 3.8 days a week. Those with mild burnout were on average in clinic 4.1 days per week. Those with severe burnout averaged 4.2 days in clinic per week. So it was nice to quantify that a little bit.
Not huge differences though in those average stat. I was
Not
expecting
huge.
more like, 5, a bigger variety. So it takes just a little bit more patient care is what it said, just to tip you over the edge.
Or you could just cut back a little bit on your patient care and have a benefit. If you cut back just a half day, according to our study, that could help quite a bit.
That's wonderful news.
Yeah. But if you go the opposite direction a little bit more, you're in trouble. Commute length was interesting. So short commutes associated with less burnout, as we all expected. But those commuting 60 minutes or greater actually had less symptoms of burnout, which was interesting. And that was also a somewhat controversial finding that was hard to back with the literature because there's not a lot of data on that. But there was one article that was talking about how younger individuals oftentimes find that commuting and time spent in the car is valuable personal time. So it's time to listen to a podcast like yours, or it's time to maybe call a friend and talk to them or something like that. And it's actually time that you can decompress if you're in the car. So I think that was an interesting finding. And then years in practice was also interesting. So those practicing less than 5 years had less burnout. Those practicing 30 years or more had less burnout. It was really those mid-career professionals, 5 to 29 years, that had the most burnout.
I wonder, and this is not a specific thing that you guys researched, but I do think there is this mindset amongst an older generation of optometrists that younger cohorts, not just optometrists, but the younger generations in general, are just more likely to talk about their mental health, more likely to talk about burnout. It's just something that they're more willing to experience and express, where they come from a mindset of, well, we just suck that up. That's normal. And you just do it and you don't complain about it. But your stat actually shows those middle generations having more burnouts than the younger generation that's just started. So maybe it's not just a thing that's in young people's heads because we talk about it more now.
Yes, there's definitely some truth to that. And if you want to delve deeper into kind of some of the statistics, you can go to the multivariate section of our manuscript, and that weeds out age and things like that. So you kind of weed out some of the younger generation mentality versus older generations mentality. But I'd say that there's something true to this. I think older generations of optometrists, they felt that coming into optometry was a calling. They were called to see these patients, to help people out. And a lot of the older generation optometrists just kind of accepted that there's going to be job stress and burnout associated with that. And I think sometimes the younger generations, and I'm not saying this is right or wrong, they see optometry is their job, but then they want work-life balance too. They want to go to work, see their patients, but then they want to live their life too. And so I think that there is a different mentality, between the different generations.
Well, and I again, this is a stat that's tough because as optometrists do become more and more female as a profession, when you look at optometry schools, it's almost, I believe, 70 to 75% female enrollment in optometry schools now. Women did experience burnout at higher rates than their male colleagues. And this is one of those things that it obviously does not involve being a parent or a childcare or a spouse. It was just very gender specific. And maybe some of the things about charting that you mentioned is a contributor. But as optometry and healthcare in general becomes more and more female, we have to kind of take this into mind, how women handle the stress and the pressures of our patient care loads and meeting the needs of everyone around us. We might be faced with different challenges to maintain that same work and clinical patient care hours because we're feeling this stress in a different way.
Yes, I'd say, so we delved quite a bit into this in our study, and we have a follow-up paper that's about to come out. I'd say we weren't surprised that females reported higher rates of burnout than their male counterparts. But we were surprised at how dramatic of a difference there was between male and females. And this was honestly deeply concerning. So we found that female optometrists, 60.9% of them had symptoms of burnout, compared to only 40.6% of male optometrists. And women were 1.97 times more likely to report burnout than men, and also 1.41 times more likely to report higher job stress as compared to men. So essentially, females fared worse in pretty much every single aspect that we looked at in our study. And like I said, we're going to have a follow-up paper coming out specifically about this. But female optometrists felt that they had a greater lack of control over their workload, that they had insufficient time for EHR documentation. They spent more time at home doing patient charting. They reported greater misalignment with leadership values with their employers. If they had an employer, they reported lower team efficiency and also a more hectic work environment. And I think that this really highlights the importance of considering gender-specific experiences and challenges when we're addressing burnout in the workplace.
A lot of research still to be done, as you said, so I'm thrilled that you're going to explore this topic further. But I do, it's one of those things that's it's very hard to generalize. No two women are the same, no two men are the same. But I do think in general, potentially, you see this in young female students, elementary school age students too. They put more pressure on themselves to please everyone around them. And some of that people pleaser that gets instilled into a girl from a very young age might continue on into their future career and jobs.
Yes.
And so how do we address that in our healthcare workplace settings where there is so much pressure to perform and be tracked and your stats and your numbers and your patient care hours and did your patients buy glasses? And a people pleaser is going to have very negative mental health responses to that kind of pressure.
Yes, definitely. And I think that this study was important because it highlights the issue. And then now people need to say, okay, what do we do about this issue? But the first step is, showing that there really is a problem. And that's what our study tried to do.
Well, I'm so excited about you teasing a little bit about future research coming because this topic has so much more to come out. So can you share a little bit about what's coming next?
Well, what's not coming next from our group is, again, a paper that's probably going to be published in the next few days that's further exploring the differences between males and females with burnout, professional well-being, job stress, job satisfaction, things like that. And then we're going to try to start partnering with people to try to figure out what to do about burnout. Like I said, we're kind of more focused on identifying the problem. But now that we've identified that there is a problem, I think next steps are trying to figure out what to do about this problem.
Yeah. I would love, and obviously this research is still to be developed, but I would love a future where some of, especially our larger employers within optometry, really kind of take a look at recognizing burnout being a problem, recognizing what can be done to affect that, and having policy changes or changes within their organization to try to help address these needs. And so hopefully as this research gets published, you'll be getting reached out to by some of our larger employment groups to see what they can do to make their workplaces a happier place for optometrists.
Yeah, that would be great. The American Optometric Association reached out to me, so I'll be meeting with some of their executive leadership and talking to them about the results of our study.
I'm so happy to hear that it's being embraced and this is just the beginning because like you said, recognize the problem step one, but finding out ways to make things better for people is the next natural step. So everyone needs to stay tuned for that research as it gets published. Where should people be on the lookout for your article that it should be published in the next couple of days?
So this burnout study was published in the Journal of Optometry. So you can either go to that website, you can find it on PubMed, you can find it on Google Scholar, but that follow-up study is going to be published in Optometry and Vision Science. And it really should be coming out any day now. And that's the one focused more on gender differences and professional well-being.
Anything else that you'd like to share with our listeners about where they could follow along with you or learn more about what you're doing within optometry? Any upcoming speaking opportunities that they could hear you at?
Yeah, we will be, myself and Netta Joya are going to be presenting this data on behalf of the Ocular Wellness and Nutrition Society at the American Academy of Optometry in Boston in October. So if you wanted to come to that lecture, you're more than welcome to. Other than that, if you want to reach out to me, I typically respond on LinkedIn, or my email address is kalebabbott@gmail.com if you had any questions.
So, Dr. Abbott, thank you so much for your time today. And as you can tell, this is research that means a lot to me personally, and I know it's connecting with a lot of our listeners right now. Dr. Glover was unable to join us today because he has a sick kid right now. So hopefully she's feeling better. Feel better, Sadie. But he always asks, what do you want your legacy to be? And I know if I got asked that, I would be very stressed. I would face burnout about the pressure of that. But I wanted to give you a chance to share, when you put away your phoropter, what do you hope the legacy you've left behind will be? Because this is the classic Dr. Glover ending to the show.
That's funny. Well, thankfully, I rarely use a fluoropter these days. I always say it's a bad day if I have to do a refraction or take out a lens to look in the back of the eye, because I'm pretty much exclusively focused on ocular surface disease. But the legacy that I want to leave is I want to make a meaningful difference in the quality of life of patients and colleagues. And I think that's why I'm really passionate about dry eye, because it's a straightforward way to take patients who are experiencing ocular discomfort, to give them a treatment regimen, try to improve that and improve their quality of life. And I also love doing research that shines a light on important issues like burnout. So maybe someone's going to read the manuscript or listen to this podcast and say, you know what, I am burnt out, and I think it's time to make a change. Or maybe it's going to open up the eyes of some employers who say, are my female ODs experiencing a lot of burnout? And if so, how can I support them? If I can, improve the quality of life of colleagues and patients, then I think that's the legacy I'd like to leave.
Well, Dr. Abbott, thank you so much, because that is a beautiful legacy and one that I hope we can all benefit from. I know I benefited a lot from listening to this conversation today and from reading the article, and can't wait to read the next one, because I'm sure it's going to have a lot of numbers that I'm very fascinated by. Until next time, we'll have you back on the show really soon, and we hope to see you in Boston.
Excellent. Thank you for having me on. I appreciate it.
If you enjoyed this full podcast, don't miss out on more engaging content. Check out the next episode right here. And for the latest updates, hit that subscribe button and ring the notification bell. Your support means the world to us. Catch us in the next episode. Peace.